71st New South Wales Nurses and Midwives Association annual conference. The 71st, just amazing. It's a great day.
This is my first year, and let me tell you, I am so damn excited. Everything, the fellowship, the camaraderie, the information, the speakers, this is just amazing.
Having dementia is not like a birthday party. It's not always fun, but I have learnt to manage to live with it and to live beyond it.
The talk this morning about dementia, that was wonderful.
Kate's magnificent. I like the session before lunch with the two economists. I thought that was just brilliant, and it's so true.
And some level of inequality is probably inevitable and probably desirable, but I'm quite sure we've got too much and we're going in the wrong direction. Over the population as a whole, the top fifth in terms of earnings will die 5 years later than the bottom fifth.
You guys create around 5 times as many jobs as the same amount of money spent in mining. And every $1 billion spent subsidising a mine is $1 billion that wasn't spent on health and education. So here's a crazy way to create jobs. Reduce subsidies on industries that create almost no jobs and spend it in industries that employ not just a lot of people, but a lot of people whose job it is to help the rest of us.
Best buy for my money in Australia, something that we could do right now, would be more community health workers and more Aboriginal health workers.
The topics that we've discussed are really insightful. They've made us, they've challenged us again.
It's more, to some degree, good luck than good management that we have, in some cases, not had more serious incidents. We're in the throes of putting workplace health and safety training, embedding it in every part of the management training courses that we're delivering.
Our challenge as nurses and midwives is to notice what we might consider to be those small interactions, because they are the things that make a big impact.
Everything was wonderful. There just wasn't enough hours in the day to fit everything in. It was so good. And Andrew Denton, well.
A law for assisted dying is not about a so-called right to die. As one Dutch doctor told me, death is not a right, death is a fact at the end of life. But it is, instead, a right to ask for help if we are dying and be on meaningful medical treatment that will change the trajectory of our dying.
Andrew Denton, he was fantastic.
I think that was a very difficult conversation to have with people in general, and I think it really brought up a few things for me.
When someone is suffering, how can we ask them to suffer more?
I would like to congratulate and commend you for the fight that you've taken up. We need someone of your profile and your passion to do this. Thank you very much.
I truly believe that the voice that will change this debate is the voice of nurses.
We are a strong and proud family of nurses and midwives, and we will not give up on the health of our community. Our campaigning will continue on many fronts and with great energy and enthusiasm from us all.
But I believe that with the strength of this union, the strength of what you do, we can continue to be the best union in this state.
We are seen as a powerful force. We are now the go-to people on health and aged care.
We are seeing an unprecedented demand on our health system. Combine an ageing population, the rising incidence of chronic conditions, greater expectation of consumers, and place them within the context of a finite health budget, and you have what some are calling a healthcare perfect storm. We are adopting innovative ways of delivering healthcare, particularly engaging the Commonwealth Government, NGOs and private providers. It's also about partnerships with the non-government sector to lever vital capital investments.
There's no point in providing capital works and beautiful new buildings without funding the staff for those enormous footprints, and I guess what I would like is an assurance that that won't keep happening.
There are trade-offs. I acknowledge the importance of making sure we have the right numbers of nurses. We do comply with the Nursing Hour per Patient Day award, to which we've signed up, and I give you my commitment that I'll continue to raise this with the Ministry and through them to the districts.
you indicated your intention to remove the long-standing protective legislation requiring a registered nurse to be on site at all times for people with high care needs. Do you believe that you have acted in the best interest of the people of New South Wales who need aged care services? And how would you ensure that the emergency departments are not flooded with unnecessary admissions from residential aged care facilities, which is occurring more and more frequently?
It's a complex issue, this, because back under the Aged Care Act 1997, the federal government is responsible for residential aged care in Australia. The problem is it's inoperable because it relates to keeping RNs in nursing homes with high care needs. Well, there are no nursing homes so designated anymore. We looked at, the categorisation no longer exists.
There is a widely, deeply felt message that you received today about our concerns around aged care here in New South Wales. So we will continue to campaign both here in New South Wales and across the country around this very important issue.
She needs to come and work on the floor in a hospital as a clinician, a nurse, and see what we do and what we have to do every day.
Disappointing.
I really think she's got bad views on that RNs 24/7.
I would commend her courage, whether it's misplaced or not.
I'd like her to remember the small rural hospitals.
When will you take mental health seriously?
Jillian Skinner, you need a reality check.
This is my first conference. I find it very informative, exciting, and everybody is very supportive.
Positive, energising, fantastic. Stimulating, friendly, encouraging. It was bloody good.
Amazing in a challenging world.
And loads of fun.
Effort into last night. So what I want you to do when you recover is to take that passion that you had last night and apply it to leading changes that we need in healthcare.
We want all of our members to be leaders of some kind in their workplaces and in their communities.
Because you have the power to change the conversation at your workplace.
This is about building the power at the grassroots level.
So we have a big vision and a challenge ahead of us, but I know that you can help us deliver.